Welcome to Well Warrior Culture, a community of support based on my books, Wellness Warrior Style, Mindfulness for Warriors, the Mindfulness for Warriors Handbook, and the 21-Day Meditation Jumpstart Journal. This is the Well Warrior Show, and I'm your host, Kim Colegrove. I work with society's warriors, protectors, guardians, and healers, and your families to help you rebuild resilience and embrace well-being. If your profession exposes you to trauma and the trauma of others, Well Warrior Culture is for you. You deserve to live, work, and retire healthfully, and I'm glad you're here. And now, on with the show. Hello and welcome to the Well Warrior Show. I'm your host, Kim Colegrove. Today, I'm speaking with Gabby Williams, who is Associate Clinical Director of the Valor Healing Program at Recovery Ways in Utah. Hello, Gabby.
Hi, thanks so much for having me, Kim. This is amazing.
Thank you for being here. I've been looking forward to talking to you, and I can't wait for you to share the important and good work that you're doing. And also, I'm going to be coming out for a visit soon, so I get to meet you in person. And
super excited.
Yeah, and tour the facility. And I'm really, really excited to do that and then to bring that information back to my audience. But for now, let's jump into the show. Welcome, welcome. And can you introduce yourself and just tell us a little bit about yourself and your background?
Yeah, absolutely. And again, thank you. This is such an awesome opportunity. So I'm super grateful. I'm Gabby Williams. I'm the Associate Clinical Director over at Recovery Ways. And I have the honor of also being the clinician and manager of the Valor Healing Program, which is our program for veterans and first responders. I've been in the field for, I want to say it's been over 10 years. I started off, I'm from Arizona, Tucson, born and raised. So started off my career there and worked at a residential treatment center in Arizona for about 5 years. Before making my way over to Utah. And that's where our program is located in Salt Lake City. And right now my role is being the associate clinical director of the facility. And then my super strong passion is working with first responders and veterans. So that's what my caseload is comprised of, is first responders and vets. And then I get to run process groups and just overall spend a lot of time with those as they go through the residential process. So
nice.
Yeah. I got into this field. I didn't really kind of know what I wanted to do, but I grew up in a first responder family. My dad was a first responder. He was a lieutenant in the police department, SWAT commander. So I know full well what the first responder life as a family member looks like. So once this opportunity came up as I continued my career as a therapist, I knew it was a right fit for me. It's been an amazing experience. So,
oh man, I love that you got into this work, and I'm finding that there are a lot of people who are former military or first responders who step out of that career and step into a career as a clinician or a therapist, and that's often very useful as long as they've taken care of themselves and they continue to take care of themselves because they really understand the world. And then also family members, people who, like you, who grew up in a first responder or a military family, or spouses, someone who's married to someone who's in the military or works as a first responder. And then also, I'm going to include, because I usually, when I talk about first responders, I tend to include some of those surrounding professions that I work with as well, like social workers, parole and probation, and correctional officers and things like that. But I think clinicians can be massively impactful when they understand that world, because it's a very specific way of life that a lot of people don't understand. Now, I'm not saying you can't be a good therapist if you weren't raised in a first responder family, but I think it's definitely helpful. I will just say one more thing before we move on. You and I spoke privately before we ever scheduled this interview, and you did share with me some of the intimate details of your father's experience that really kind of pushed your hand in terms of wanting to work at, in mental health, but also specifically work with first responders. Do you feel comfortable sharing that?
Oh, absolutely. I think it's a huge, anytime we go through, whether it be whatever experiences we have in life, I think, we can use them for meaning in one way, shape, or form moving forward. And so with my dad, he was, like I mentioned, he was a lieutenant in the police department, and he completed suicide when I was 13 years old, struggled with substance use, alcohol use, and just really struggled and never got the help that he needed. And he was such a bright soul. He always smiled, just an amazing man. And you never know that he was struggling. And as so many of our first responders get really good about hiding things and, of course, being the strong ones and always wanting to help others. I think it's really helpful to, be able to use what I've been through and use it for a positive experience. And so that's really been something I've worked really hard on, definitely being able to separate my experience from those who I work with. But I think always connecting to our why, our why for being in the field and what really drives us. And I think that, that for me, I just wake up super grateful every day that I get to do the work that I do and kind of live out that legacy piece. So I'm very grateful for that. And grateful that I had the dad that I did.
Yeah, it's really a beautiful story, and it's a great use of your life. And thank you for sharing that. I think most of my audience members know that I do this work because I lost my husband to suicide. He devoted 30 years of his life to a career in law enforcement. And then just less than 3 months after he retired, he took his own life. And so you and I have some things in common around that. And I can say, really clearly, the driving force for me is if I can prevent any family from having to go through what your family and what my family went through, I want to do that. So whether I can impact the professional who's struggling or have an impact on their spouse or a family member, then I'll do whatever I can do. So that's why we do these interviews, and that's why we have the courses, and I wrote the books, and I am just shouting this from the rooftops all the time. If you are struggling, please get help. Like you were just talking about, so many of them are wearing a mask. Like you said, your dad smiled all the time. He was a happy guy, and he was there to take care of others. My husband was absolutely a caretaker. I mean, there's this thing we say about him that is, if the ship's going down and you want to survive, stand next to David and you'll survive. He was that in the world. But a lot of times these people are wearing a mask. And so I guess what I would say to anyone who's listening, who might want to hear a little more about what you're going to talk about in terms of what's it like to go through a recovery program? What are the steps and what are the typical fears? I would say if you are feeling the pressure and the weight of this job and something is wrong or something's off, take off the mask and find at least one person you can be honest with, a mentor, a peer, your spouse, a sibling, a trusted best friend, even just one person that you can begin to have this conversation with, because wearing the mask and pretending everything is okay is only sustainable until it's not.
Absolutely.
Yeah.
Yep.
Yeah. So thank you for telling us about yourself and your background. I want to know about the Valor Healing Program. I want to know how that came to be within Recovery Ways. And so anything you feel like sharing with us, just jump right in. I will start by just asking you, I know that you probably encounter a lot of people that don't really want to be there in the beginning. And so what would you say as a clinician and as someone who's done this work for a long time to someone who knows they might need some kind of help or intervention, is on the fence about it, but just terrified to take that step?
Yeah, I mean, I think that's probably the number one thing that we do encounter. It's not ever in anybody's plan to come to treatment. Nobody, especially first responders, never expect to kind of be in that vulnerable space to have to make that choice on whether or not, going to treatment, you're sacrificing a lot. You're leaving your job, leaving your family, and doing something that's completely outside your comfort zone. So it's one of the hardest steps to ever take. And I don't know if there's anything that really is helpful in terms of making things more comfortable or making that decision, one that's more doable. But I mean, I keep it really simple. Take the step, try it out, and I always tell people, give us a week, give us a week, settle in, see how you do. And then after a week, if you're still like, no, there's no way I can't do this, then we'll talk about that. There's nothing that says as soon as you walk through the doors, you absolutely must stay here for a month or however long it is. There's nothing that says that. Typically what I've noticed is that once you do take the step, and that once anybody who I'm working with just gives me that week, usually they will settle in and start to really, really do the work and get comfortable. So it's really interesting how that time frame, and I talk about it with all the first responders I work with, and especially towards the end of their treatment, we talk about like, hey, remember when you first walked in the doors? And they're like, yeah, I know it was rough, and I, was really struggling, but I'm so glad I gave it that chance that I did. And that's really all that we ask. Because even if it is, a couple weeks and you still decide I can't do this, hey, you took a really vulnerable step, you opened that door, and that in itself is a win. So that's usually what I stick with.
I would think they are bound to at least pick up a few helpful things, even if they're only there for a week or two,
That absolutely. That's the thing we have to do, is celebrate those wins, and literally taking that step through the doors is a huge win, especially for our first responder and veteran population. That is the hardest step to ever make. So
I've heard that over and over and over again. Yeah, I've heard that from people that I've talked to, interviewed for my books, or people that I know personally, how difficult it was to take that step. But nobody that I've talked to has said they regretted taking that step. Every single person who's opened up to me about this has said, yeah, that was a hard one. And it took me a long time to say yes, and I didn't want to go. And sometimes they'll say, my spouse gave me an ultimatum and that's why I went, like, whatever it is, that last push. But they always say, man, it was a life changer. I'm so glad I did it. And one thing I think people worry about, Gabby, and I bet you run into this a lot, is that it's going to be just a killer for them professionally. Like if they take this step and they go get this help, they're done in their profession. And that is false. That is false.
Oh my gosh.
Can you speak to that?
Yes, that could not be further from the truth. The first responder world is changing in a positive direction as far as the focus on mental health and just the recovery process in general, and addressing trauma and anything and everything. So that's a huge plus. What I've noticed with most everyone I've worked with is that they have the blessing of their department, their agency to come here, take as much time as they need. You're right, though. There is that fear of, okay, yes, I can come to treatment and I can do all the things, but what happens when I get home? People are going to talk about me. There's going to be that stigma that I run into, and I get it. And everyone that I've heard from, when they get home, they're like, hey, you know what? I'm proud to have done what I did. I'm proud to have taken that step. And it's so interesting because so many of those who come through the program end up wanting to be some sort of peer support, get involved in the mental health world after they leave here. So using their experience for good as well. So there absolutely is that fear. And that's something that we talk about throughout the process. I don't sugarcoat that, because I know that's a huge elephant in the room, because they are going to have to go home. They are going to have to, go back to work
And
and see
people
what that
will
looks
notice
like.
they've been gone, and people will
Absolutely.
know why they've been gone, and things
Yep.
like that. That's just part of the whole package. But what, to your point about people who complete the program and then go back into their world, go back to work, and
Mhm.
and not everybody wants to go back to work. Not everybody will
Absolutely.
go back to work. For some
Yep.
people, I'm sure they realize, yeah, I can't do this anymore. But for
Hmm.
people who are still invested in the profession and want to continue, I mean, to me, I know this is simplifying it for someone who's really struggling right now mentally and emotionally, but to me, it's like if you get injured at work and you break your leg, you're going to go and get treatment, and you
Yep.
get the time off work, and you're going to have to do some kind of rehab, and
Hmm.
you're going to be out for a while. But that doesn't mean you can't ever do your job again because your job requires you to walk. It just
Right.
means you have to let that leg heal. And then, you might have some different duty for a while till you're fully healed. But we just have to start thinking about our mental and emotional health in the same way we think about our physical health.
Yes.
If you've taken in and taken on so much mentally and emotionally, uh, as part of your profession, and something inside of you kind of cracks or breaks or fractures, and you're not good for a minute, that's normal. That's typical.
Yeah.
So if you can go and get the healing and get the care that you need and heal those invisible inner wounds,
Hmm.
then there's nothing that says that you can't go back and maybe be better than you were before at your job, because now you have all these tools to really take care of yourself. And something I'm seeing across these professions with people I'm meeting that do go and get the help, go to therapy, counseling, go through a program, is they become these informal leaders within their organizations. So they might not be the ones promoting, they might not be the chief or the boss, but they're these informal leaders that uh, they gather this courage to come back and say, I went to treatment, and some of you guys should probably go too. I'm feeling so much better. And they talk about their experience. They allow
Yep.
themselves to be vulnerable. And those are the people that are changing the professions, the ones
Yep.
that are courageous and brave enough to speak about, yeah, I got help. There's nothing for me to be ashamed of. Yeah, I bet
Hmm.
you see some of those people emerge from your program.
Oh, absolutely. And it's funny because even while they're here, they're like, man, I could name probably about 25 different people who should be coming here too, right? And or should be getting some sort of treatment themselves. And whether or not you go back and you shout it from the rooftops of where you've been and what you've done, you don't have to do that.
Oh,
If you
no,
do,
you don't
great,
have to.
awesome.
Yeah,
Yeah,
yeah.
it's your choice. But ultimately, even people are going to talk. Maybe people ask questions, but ultimately, you're going and taking care of yourself, so you're opening that door for other people to say like, all right, you know what, if you went there, maybe it's time for me to take a step back and see what that looks like for me, right? So you're always opening the door and just kind of reducing that stigma more and more. So yeah, I mean, it's an amazing process to see.
Yeah, that stigma, that's something that those of us who work in this world, we face and we talk about all the time.
Hmm.
It is one thing that prevents people from getting the help that can change their lives, help them to keep the job,
Hmm.
or heal the marriage, and all the things.
Yeah.
Is not worrying about the stigma. But again, that's easier said than done, and I really do understand that,
Hmm.
because of the centuries of conditioning in these professions. You are the help, you shouldn't need help. If you're not
Hmm.
mentally and emotionally sound, then there's the door, you can't
Yep.
do the job. And that's all kind of outdated rhetoric now, isn't it?
Hmm. Yep, it is. And that, the suck it up, just keep pushing forward. I get it. I get where that comes from. And at the same time, you're not doing yourself any favors because that's not sustainable. We're all human, regardless. When you put on that badge, you're still a human. You're still a human with feelings. You're still someone who deserves to take that step back, and heal, work on those things that you need to. You deserve that, right? And so that's a huge part of the process too.
Yeah. I mean, if if they're tuned into this, somebody who's tuned into this, who hasn't taken the step yet, if you would just go read a book, finish listening to this recording, go find another one,
Yep.
speak to one person. I mean, start opening your world, opening your mind, and opening your heart to possibilities,
Hmm.
because I know this sounds a little dramatic, but I've said this a lot of times, and I feel this. We are sacrificing people to these professions.
Yeah.
We are bringing people in, and unfortunately, sometimes these professions will ruin their mental and emotional health, sometimes their physical health, because of the years of stress that they endure. It eventually impacts their physical health as well. Very high rate of divorce. I meet a lot of older people. I'm almost 58. And I meet a lot of people my age, around my age and older, who have estranged relationships with older and adult children because of, the years when they were a young go-getter and, maybe weren't taking care of their personal relationships. So there's a lot of reasons to rethink things now and modernize how we look at this. We need to have a healthy military, mentally, emotionally, and healthy first responders that are out there taking care of public safety. And someday, Gabby, I think this will be like a preemptive strike. We'll start taking care of these people earlier. But, wherever you are in your career, today is the day.
Yeah, absolutely. It's never too late, never too early.
Yeah, exactly. So will you share a little bit? I'm curious about this, and I think that people listening might be too. Can you give us just kind of a day in the life experience? Like, what is it like when they arrive? Like, what could someone expect when they, arrive for their kind of orientation in their first day or two?
Yeah, absolutely. So typically, as soon as you get here, there's a process starting off where, you speak to an admissions counselor and they'll help kind of gather some preliminary information and then fly you out to Salt Lake and start the process. And I think you had mentioned a little bit earlier where, coming to treatment again is completely difficult. One of the hardest things you can do. And also, if you are going out of state, it sometimes even seems harder. Yet I think that's one of the most, helpful things is removing yourself completely. Because if you are completely removed from job, you have a little bit of a break from your family. I know that oftentimes is really hard to leaving family.
Yeah.
But it gives you such a wonderful opportunity to just focus on yourself.
Yes. Oh my gosh. I think before I turned on the recording, we were talking a little bit about, I said a lot of people want to leave their state and get treatment elsewhere because they don't want people in their immediate world to be in their business, which is, fair enough. So we were talking about that. And I agree with you wholeheartedly. I understand wanting to get completely out of your own environment and to just go someplace to get this help and this assistance and this kind of clean slate. But I mean, you don't have to go out of that. Some people would rather, go to a facility that's nearby so that they can have visits from their family or whatever. That's really a personal a preference. But I understand the point that you're making, and it makes sense to me too, to kind of just get up out of your comfort zone.
Absolutely.
And your familiarity. Yeah. Seems like a great idea.
Even if it is right down the street from your house, hey, but still, as long as you're giving yourself that opportunity to just completely focus on you, more, that's the best thing that you can do. And so as soon as you get here, within the first 72 hours, we'll have you meet with a psychiatrist to do a psych evaluation, have you meet with a doctor to do a history and physical, and then within the first day, you're going to do an assessment with a therapist. And that usually is me. If it's Recovery Ways, it'll be me for the first responder program. So that way I get a chance to just sit down and get to know you. Listen to your fears, listen to, if, again, you have the opportunity to share like, hey, I don't know if this is the right step for me. Again, totally fine. Let's talk about that. Let's see, what this is going to look like, and then we can move forward. So we'll always explain the program as a whole. And so you can have a little bit of an idea of what things will look like, what you can expect. Because there's nothing worse than not having any idea what you're getting yourself into and what you're going to expect, right?
I would think that would be a huge fear, the unknown.
Oh, absolutely. Yeah. And our admissions counselors are wonderful about doing that ahead of time. And then also, we all know that it's a whirlwind prior to, especially when you're really struggling. It's hard to remember all the ins and outs of what's explained to you. So we want to do that again and make sure you have a really clear picture about what you're going to be experiencing while you're with us. And so day in the life moving forward from that, we're a 24/7 facility for residential. So from usually about 8 in the morning to we have programming up until usually around 7:30, sometimes 8 at night. And there's groups going throughout the day, groups dedicated to just anything and everything from trauma recovery. We have grief and loss. We have small process groups where you get an opportunity to just share anything on your mind, on your heart. We have groups related to just coping skills. We really try and vary it and mix it up so that you leave here and have as many different skills and introduction to concepts as possible to anything.
That's what I love. Yes. That's what I love so much is sending the people home with tools.
Yes.
Because it's one thing to spend some time away, let everything settle, feel a little healing, get some sleep, get relaxed, get to talk about, offload some of the heavy stuff. But you got to leave with tools. You got to know what you're going to do when you go back home and when you go back to work. So I love that you offer lots of skills and tools. Do you have separate tracks? Like if someone comes in because they're struggling with substance abuse, but someone else has, is there more for trauma recovery, something like that? You have different tracks. Can you explain that?
We do. Yes, absolutely. So we have two different facilities. One is called Brunswick West. It's our facility we have our detox unit in Brunswick. And then we also have, it's our substance use dual diagnosis program. So those who are coming strictly for dual diagnosis and substance use recovery will come to Brunswick West. For our first responders, we really have them go over to, it's called Copper Hills. It's our mental health and trauma program. You can have a substance use diagnosis and still go to Copper Hills. And we really like to have our first responders all go over there just so that there's that huge emphasis on not only recovery from substance use, if that's something that you're struggling with, also there's that huge emphasis on mental health and trauma recovery. I never like to assume that anybody has PTSD or PTSI or mental health issues. And at the same time, just with anything that first responders and veterans have gone through, there's a likelihood that they've encountered something that's been traumatic for them, right? And so just having that emphasis and having that information is going to be really, really powerful as far as the healing process goes. So we really, really like to have them over there. And then as far as our Valor Healing Program, we have that built into our mental health and trauma program. So those coming for treatment who are first responders and veterans will be housed with civilians as well coming for treatment. Yet there's separate and specific programming just for our first responders too. And I know that can be a concern sometimes. I hear all the time of,
for sure. Yeah.
Yeah. Right. Like, I just want to heal with other first responders. They're the only ones that understand. Rightfully so. I completely valid. And what I found is that it's actually a huge benefit to be housed with civilians as well, and also be going through additional programming, because one can start to really realize how much just we as humans relate, regardless of our experiences. And it's so powerful to see that initial, like, ooh, Gabby, I'm really not going to start driving with these people who have no idea what I do, what I've seen, what I've been through. And then they wind up being amazing friends with them. Like, I usually walk in and I'll see one of our first responders playing chess with one of our 19-year-old patients. So it's really interesting to see the friendships that are formed and just the relating that starts to happen. It's really powerful. So
Yeah.
there's
Just a level of vulnerability and trust that they have to dig up somehow to step into any of these programs to really change and turn around their lives and help them heal. So we could spend hours and hours, talking about all of the many fears that they might have about reaching out for help. And there are many, and it's valid. I understand that. But at some point, you just have to take a deep breath, set aside those fears and step into the unknown. And as we know about this particular population of people, the unknown and the uncontrollable is not really their jam.
Yeah, that's very true.
So I give them a wide breath and just really empathize and sympathize with how difficult it is to take this step. But what I would like them to focus on is other people who have taken the step. And there are some people in my books that will share they took the big step to leave their family and go away for a month. And it saved everything, saved their life, saved their marriage, all kinds of things. So
yeah.
Even
Absolutely.
those little details like that, well, I really, I'm really only comfortable with cops. I don't really trust anybody else. Well, let's just give it a minute.
Yep. Absolutely. And that's a piece where, I've seen it time and time again. So I have a ton of confidence in saying, hey, give us a little bit, give us a week, see how you do. And again, if at a week you're still like, nah, not happening, we'll work with you. We'll see what that looks like for you. And again, like you said, even if it's a week that if we're able to focus on yourself and maybe pick up something. So
for sure. And they're in groups. They're going to be in groups with other first responders and veterans as well.
Yeah.
I mean, it's not like they're just thrown into. Yeah. I mean, this is a common problem across all these professions, that separation, like the good guy, bad guy thing, I've talked to correctional officers before and said, it's like trauma is on both sides of the bars.
Yes.
And easy for me to say, right? Because I'm not, a correctional officer, but I think both sides would benefit from understanding. A lot of times there's childhood trauma, early life trauma, other than professional trauma. And then for the corrections professionals, they've got that professional trauma, but there's so much of that on both sides of the bars. We're human. We're all human beings, And I think that's another thing for first responders and veterans to consider when they get caught up in that story of no civilian could really understand what I've seen. I agree with that. They cannot understand. But there are other things that people experience and endure that aren't what you endured and aren't combat or aren't, the critical incident that has brought you here, whatever that is. But trauma didn't get that memo. When people are impacted by trauma to the point that it's, creating addictions and mental health problems. Anyway, I'm kind of rambling about that, but trauma doesn't get that memo. Trauma takes us to the level of we're both human beings. We're just all human beings. You said something earlier that I loved about, I can't remember if we were recording yet or not, when you said something about we're all born with the same emotions. That sometimes people in these professions, first responders and veterans, they think they aren't supposed to have those softer emotions. They aren't allowed to have the sadness and those that they're just supposed to be on and tough and be the help. And, they save, they rescue, they fix, and they're not supposed to have those but that's such nonsense. If you want to speak to that a little bit, it's so dangerous to try and separate out or deny that some of the emotions that as a human being you're born with.
Absolutely. And that's the piece where you're right. First responders and veterans are taught like you don't have those. You're get on out there, do your job and go home at the end of the day. Right. And obviously that's a huge emphasis, yet we're human. We're all going to have emotions, and it's natural. We get very good about learning how to shut them off, right? And whether that be through, you know, alcohol use, or we just get really good at shoving down the feelings and just keep pushing forward. And you had said, right, like you can do that until it doesn't work anymore,
Yeah,
right? And
that's
then,
sustainable until
yep,
it's not.
yes,
And
exactly.
and a lot of times it just happens like that. You know,
Yep.
sometimes it's a slow, gradual, it's creeping up, but sometimes like I was okay yesterday. I don't know why today I can't function. I mean, you just reach that point where you just can't do it anymore. Will you speak a little bit to, I have a friend who she was a combat veteran and a police officer, and went through a group therapy program. And part of the story that he tells is after he had experienced some of this healing and had done one particular part of the program, which was really impactful for him, that as he was leaving that area where they were doing this one healing ceremony, practice, whatever they were doing, that he looked up and all of a sudden he became aware of his surroundings. Like he could feel the wind on his skin all of a sudden. He could see colors. The colors, he said, looked more vibrant than he had ever noticed before. And he just noticed the sky and the sun. And he said it almost felt emotional. I think he said something like that. And it scared him. It scared him because he was noticing the brilliance. And he talked to the clinician on site about that. And that clinician said something about, you have numbed or dialed back or turned down your emotions for so long that your body has literally dialed back your senses. And so can you speak to that? Because I think there are a lot of people who think they can pick and choose. I'm going to turn off sad because I see too much sadness with, so I'm going to turn off those emotions. Can you talk about what happened? First of all, Gabby, is it possible for us to turn off one or two emotions and for the other ones to be fully online? Let's start there.
Gosh, that would be wonderful, right? If we could just turn off sad, angry, lonely, go with the others, then we'd be golden, right? I always tell people that you can't have joy, peace, happy without the other emotions. The other emotions are, I don't ever delineate bad and good emotions because all emotions are always serving us in one way, shape, or form. So if we're feeling sad, angry, lonely, those emotions are telling us something. And that also means that we are allowing ourselves to have peace, joy, happiness, right?
Yeah.
And we do become conditioned to just kind of numb and not feel anything. And that kind of existence is so hard, right? Because you can't enjoy the wind on your face. You lose enjoyment in pretty much anything, right? So even if you aren't at the job and you're home with your family, you're losing that enjoyment of being able to sit down and play with your kids, right? Because you're not fully present. You're not there. You're not attaching to the emotions of the moment. And so you wind up just kind of existing. And it's so powerful to see our first responders really end up connecting, especially to things like mindfulness and just those basic, I know you know mindfulness well, right? Being able to just be present and just start connecting with themselves and with their emotions. That in itself, if nothing else is learned or attached to while they're in treatment, that alone is such a beautiful benefit of the process, right? Because that means you can start going back and learning how to be okay just sitting with your family at the dinner table and finding a little bit of peace in that moment, right? And so those are huge wins.
Yes, yes, yes. So a lot of people that first open up, I'm talking about this population that first open up to help or healing, really turn their nose up at things like meditation and mindfulness, yoga, and kind of the woo-woo stuff, which I understand. Initially, I understand it initially, but once you understand what mindfulness is, what it really means, and I find these are smart people they are smart people, or they wouldn't be able to have the job that they
Yeah.
have, right? And so once we address their analytical mind around that, and just kind of teach them what mindfulness means. I mean, we're not talking about come in here and sit cross-legged on the floor and I'm going to light some incense and we're going to chant. That's not that.
Yes.
But when they understand that it's about um, presence and developing the ability to bring your own attention or your own awareness into the present moment, right here, right now, when it will serve you, which is almost all the time, it will serve
Yep.
you, to be present. And then when they can relate that back to their relationships, and a key relationship is their relationship with their children. That's, it's an important one, because kids grow up fast. And when you are busy and you're devoting a lot of your time, energy, and effort to your profession, which is a demanding profession, and the profession exposes you to trauma, and so is also very life-sucking, and you just don't have much left in the gas tank anytime you're home, the kids grow up extra fast. Because it's just happening kind of unconsciously around you as you're operating in this kind of survival. And unfortunately, people will do that for 20 or 25 or 30 years, and they love their people. I mean, they love their children. But they're not checked in. They're not present. They're not involved. They're not as invested and connected as they can be once they understand the power of healing themselves mentally and emotionally, and once they understand what mindfulness and presence means, and then they learn the power they have when they adopt these kind of practices. It really can be so life-changing. And I want to say just one more thing to that, which is if you ask for help, if you go to a group therapy program or to a residential program, or you start therapy, whatever it is, and your employer supports that, your boss or your employer supports that, that's all great. But don't forget, you're not just going so that you can keep your job, so that you can be better at your job. There are many other components to your life that will benefit. And I want to start bringing a little more balance to, every training or every healing or every step you take is not just so you'll be a better cop or a better firefighter or a better medic, or, yeah, for sure. Well, you get some healing, then yeah, you'll be able to finish out your career. But also let's think about our personal relationships, our siblings, our parents, our children, our significant others, our friends, our hobbies we used to have, the things we do for joy and pleasure. All of that, the big picture is what I want people to consider. You do not have to live out your life the way you're feeling now. It's a choice. You can, and people do. People retire and they think they're going to be fine. It doesn't always work out that way. But yeah, so I kind of went off on a tangent there, but I just want people that listen to these kind of things to consider that bigger picture and the bigger picture of their life, and how opening up your mind to something simple like mindfulness and taking that home and applying that in your life, the power that can bring to you getting checked into your life.
Absolutely. And if you think of a lot of times people do come and they say, hey, I'm here because work is telling me to be here. Not thrilled with it. Awesome. You know what? If that got you in the door, great. We'll take it all day long. But my goodness, that benefit that starts to sink in of, okay, I'm not just a police officer. That's not my sole identity. Or I'm not just a firefighter. I'm not, whatever it may be, where that's so ingrained, right? Like, hi, I'm so-and-so, I'm a police officer. Hi, I'm so-and-so, I'm, XYZ. So much more than that. And I think once you have a chance to step back and really recognize that, that's where those pieces start to fill in of, okay, wait a minute, I have to be here and I have to be fully present so that I can enjoy my family. I can enjoy when I go out fishing or when I do whatever it might be. So life just becomes so much brighter, and not just the profession, but just anything, right? Yeah.
Yes. Oh my gosh. I just have this dream. I have this vision of, eventually I think we'll start introducing and interspersing this more in the trainings and the academies and the boot camp and the, just hey, it's important to take care of your mental and emotional health, and here's how, not
Yeah.
just that you should, but here's some
Yeah.
things, we recommend. But also this becoming normal rhetoric and normal dialogue. And
Mhm.
then, thinking about, what I know we have now is a lot of people in these professions that are stretched to the max and not doing great. I mean, I have friends, that are in the profession that are, not great.
Yeah.
But thinking about having, healthier public safety individuals, because we start, integrating this into these professions. It's hard professions. I mean, we should have care for mental and emotional health.
Hmm.
And every single one of these people deserves to live and to work and to retire healthfully,
Yeah.
not just survive,
Yeah.
not just operate on autopilot, because they're good at their job while the rest of their lives fall apart.
Hmm.
So, yeah. So I don't know. I hope that we are answering some questions for people, and I hope that we're giving people some things to think about, and maybe even helping to usher people, a little closer towards getting some kind of help, not just operating in survival mode.
Yeah, absolutely.
Yeah. Anything else you want to share about your program in general? Or
Yeah.
anything that you guys do there that we should know about? What else would you like to share with us?
Yeah, absolutely. I think as far as the Valor Healing piece, I mentioned that we do have you know, programming specific for first responders. So we do have small groups dedicated just for our first responders and just for our veterans. And so those are small groups, usually about an hour and a half. We have those twice a week where our first responders and veterans can get together. I do one of them, and one of our clinicians does one on the weekend as well, just so that they can have time to share those pieces that they feel like others, civilians, would not relate to, right? And I always call them kind of, I tell our group members, like, hey, this is filter free. Don't feel like you have to caretake for other people. Don't feel like you have to censor anything. Go for it. Everybody in the group is so respectful as far as never one-upping each other. There's no war stories. It's really, really nice to just be able to see everyone come together and just share those parts that they feel like others just might not be able to relate to. And it's not always first responder specific things that they talk about. It could be, hey, I want to talk about my relationship with my wife right now. It's not great. And so they go into that. And it's a really nice environment where they know what's shared in that group doesn't leave that group. It's a sacred space. So
That's outstanding. And yeah, and
mhm.
gosh, there's so much more they can share about other than what they've experienced on the job.
Yeah.
And they can be such great comfort and counselors for each other.
Hmm. Yeah,
Yeah, I love
absolutely.
that. You mentioned something earlier, and I'm thinking about it now as you're talking about this, that camaraderie amongst people who do this type of work. And I think something that's very common that I hear from retirees is the over identification with the job.
Yes.
That like it is who they are.
Hmm.
And so I just want to kind of throw that out as a cautionary tale to maybe check in with yourself. Has this become who I am? Who am I outside of this job? I need to remember this is my job. I might be really, really good at it, but it isn't the totality of who I am. So that's something that people retire, they don't realize until after they've retired, how
Yeah.
much they over identified with the job. And then the other thing is separating from the job. That is very difficult for a lot of people. And I think it's a good thing to be aware of ahead of time.
Yeah.
So when people separate from the military and they don't anticipate that they're going to miss, I've heard them say, that was my family, that was my team, that was my tribe, that was my, I didn't realize, coming home or leaving that, how much I was going to miss that. So that's something
Hmm.
to be aware of. And same thing with, leaving, like, let's say law enforcement, ready to retire, want to spend more time with whatever, doing what I want to do, and then retire, and then shocked by you're gone and the job went on the next day like you never existed.
Yeah.
And so kind of getting a hold of some of this mental and emotional stuff now, um, thinking about, doing a little inner reflection now
Mhm.
to to hopefully avoid some of that over identification that you don't become aware of until after you retire.
Mhm.
These are other elements that going through a program like this can help you bring balance to. You
Yes,
think? Yeah.
absolutely.
Yeah.
Because you get to take that hat off while you're here, right? You get to just be you're not officer so and so while you're here. You're just John. You're
Yeah.
just Joe, right? And that's who you are. You get to be that person, and you get to just reconnect with yourself. And then also, I think one of the biggest things is that while you're here, we call it our tribe. You're part of that community, right? Community and connection is paramount because you're absolutely right. Especially once you retire, once the job is no longer there for whatever reason, you still exist and you get to live that life worth living, whatever that looks like. But we want to move towards making sure it's a life that you enjoy and that you're peaceful in and that you're settled in. Not, when you get there, all of a sudden it's like, oh my goodness, now who am I and what do I do?
Yes.
So
Oh, and it's
yeah.
more common than people realize. Like, I'm not
Oh my
trying to
gosh.
be a
Yeah.
fear monger, but it's more common. People, so many people think they'll be fine, and then it hits
Hmm.
them, like a
Yep.
ton of bricks. Do
Yeah.
you ever find that do people uh, you make friends in your program and then leave and go back home and stay in touch? Do you ever hear about that?
Oh yes, all the time.
Like there's like a
And I
camaraderie or something that they connect over and then stay connected after they leave.
Yeah,
Mm.
especially the first responders, they get really, really close, and it's that camaraderie of, okay, I finally was able to be vulnerable and be able to open up with people about things I've never talked to about, and so yeah, those relationships keep going once they leave here. We have an alumni program, so they really stay connected that way as well. But yeah, I always hear like, oh yeah, I was texting so and so, and they're doing great. I'm like, oh, okay, great. I love it. I love it. I love that you're
Yes.
still connecting, and so that's always really beautiful to hear
I
too.
love that too, because a lot of times I think people by the time they come to a program like this, they're really isolated.
Yeah.
You know, they're really
Hmm.
isolated. I know there are a lot of people out there right now, this very moment, who feel completely alone because
Yeah.
they think they're the only one. It's probably the most common comment that I get about my books is hearing the stories from the other people changed everything for me because I didn't realize other people felt like this. I mean, I've had people say, I, you know, I thought I was effed up. I didn't realize other people felt as bad as I felt.
Yeah.
Yeah, whole bunch of you. There's a whole bunch of you. Yeah, and like let's be honest about it and help lift each other up. You
Yeah.
are
Exactly.
not alone, absolutely not alone.
Hmm. Yeah.
All right. Well, as we kind of start the wrap up, first of all, I'm coming out to tour your facility and meet you in
Yeah.
person and spend some time out there. I'm really excited about that. And then can we get back together after that and have another chat?
Oh my gosh, absolutely. I think it's going to be awesome because you'll see all the other awesome stuff we're able to offer our first responders, like occupational therapy and our sensory rooms, and just so many little
Yeah, you guys have
nifty things.
I mean, I've talked to a couple of different people with your organization, and you have so many cool little touches that you
Mhm.
add to make
Yeah.
people feel, help them relax and let down their guard and be comfortable. I love that. I can't wait to see it with my own eyes. I
Oh, I'm
can't
so
wait to
excited.
come and visit and just kind of take in the whole entire big picture and then be able to kind of report back to my audience like what that was like and what like they can expect. And I'm excited to
Yes.
meet you in person too. So
Oh, yes.
we'll find a date after that and we'll come back together and talk. And then if anyone's curious or interested, you want to throw out some contact information, like can they just go to the website and kind of like what would be the best way for them to learn more about recovery ways and about the Valor Healing Program?
Yeah, absolutely. Website probably I would say is the most friendly way of being able to just kind of poke around, explore, see what that looks like. It's www.recoveryways.com, and that really gives you the opportunity to just kind of see what we have to offer, and what maybe you can expect. There's a lot of information on there as far as, how you can, what you can expect, what things will look like. It has pictures of all of our facilities. And so you can start to get a little bit comfortable. And then there's a whole piece there on our Valor program. There's contact information for our admissions team, and yeah, just lots of
Okay, so everything they need
avenues.
to know in terms of looking
Yep.
into insurance and everything, just go
Yep.
to the website.
Yep.
Okay, great. Well, I will include that website in the show notes.
Awesome.
And anything else you want to share or include before we do our wrap up and say goodbye?
Just even thinking about the possibility of just taking a step back and getting help is, oh my gosh, that's a huge, huge step. That's a huge part of the process. So that vulnerability is going to, carry you so far. So
Yeah. And there are thousands and thousands and thousands of people out there who have already done this, who have already
yeah,
taken this step. And
yeah,
so far, I haven't met anyone who regrets
yeah,
taking this
yeah,
step, to heal themselves.
yeah.
All right, Gabby. Well, thank you so much for the really important work that you do in our society. I appreciate you so much. We need a whole bunch of caretakers to take care of our veterans and first responders and public safety professionals and all those surrounding professionals who are working hard every day in public safety, as victim advocates, all this really social workers, all this really difficult work. Thank you so much for being someone willing to dedicate your life to helping these people that help us. I appreciate you.
Oh, and thank you as well. This has been such an honor, and I am so excited to meet you in person. So
I'm having a lot of fun getting to know you guys. I can't wait to come out there. All right, Gabby Williams, Recovery Ways, thank you so much for your time today. Take good care, and we'll talk to you soon.
thank you.
All right, bye-bye.